Jefferson County Drug-Free Coalition, established in 2017, is a group of people and organizations working together to prevent and reduce the abuse of alcohol, tobacco, and other drugs among youth in the greater community. Their members include parents, youth, school staff, law enforcement, pastors, healthcare, and government workers. They invite anyone from the community who is interested in substance abuse prevention, treatment, and recovery. Today I am interviewing Venessa of the Jefferson County Drug-Free Coalition. Welcome, Venessa.
Open our hearts, free every soul. The fear inside, you must let it go. Oh, that monster, before it conquers you. Yeah, we all have demons, we fight every day. You get knocked down, but the bell hasn't rang, so keep going. Just stay focused when life seems hopeless. Before life passes you by, you must, like a bird with broken wings always. You've got to reach for the stars. It might seem far. Ooh, don't stop. You gotta try. Oh, 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 you gotta try. Never stop dreaming, even away. Nothing can stop you from winning this race, so keep going. Just stay focused. Yeah, I am the tiger, I own the prize. Every storm is with the rainbow in the sky. You are golden. If no one else noticed, don't stop, keep going. Before life passes you by, you must, like a bird with broken wings always. You gotta reach for the stars. It might seem far. Ooh, don't stop. You gotta try. Oh, 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 you gotta try. You gotta try. All you got to do is try. Oh, you gotta 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 try. You gotta try. All you got to do is try. You gotta try.
I think the biggest piece of advice I have for someone going through addiction or thinking about going to rehab is being honest with yourself. Don't be afraid to get help. I think that's the biggest stigma that we're trying to erase is don't be afraid to ask for help.
Hi, welcome back to ICAN. Today we're talking to Venessa from Jefferson County Drug-Free Coalition. How are you doing, Venessa?
I'm good. Thank you for having me here.
Tell us a little bit about the coalition and go into detail how it started and how you came involved with it. And
Yeah, so I mean, I can't probably talk too much in depth about like the creation of the coalition as I started just about a year and a half ago.
Right.
But From what I understand, the inception or creation of the coalition started back in like 2016, 2017 time.
Okay.
I believe they probably had a different name. It was probably AODA prevention of some
I
sort.
believe it was, yeah.
So once we got the Drug-Free Communities grant, though, we kind of rebranded and now are called Jefferson County Drug-Free Coalition. So obviously we've been operating since about that 2016, 2017 time and carrying it through. So
Tell us a little bit of how you're in the community, what you do in the community with, and where you get your funding, and so on.
absolutely. So first, starting with the funding that we receive, again, we have the Drug-Free Communities grant. So it's a 10-year grant through, used to be SAMHSA, but now it's through the CDC. They had taken that over, I think, around in 2020, 2021 time, give or take. Which 2020, 2021 time is when actually we were awarded for the coalition.
Okay.
And with the grant, it's in 5-year increments. And
Okay.
again, you can have it for a total of 10. So currently we're just nearing the end of year 5 for us. And then we're going to be going into year 6 as of October 1st. So next week, Tuesday. As far as the work that we obviously do for a coalition, it's substance misuse prevention, particularly with youth, but we do community-wide initiatives because we know, obviously, of course, targeting our youth is very important, especially to get to that primary prevention, but of course you have kiddos that maybe like need deflection or diversion that are already struggling with substance misuse. But then we also want to look like at the family component and what that kind of entails. So educating the parents, educating other key community partners, and we focus on underage drinking, tobacco, nicotine cessation, as well as prescription medication misuse.
And what about vaping?
Yes, so that would fall under the tobacco nicotine cessation because I know before, like, I think we were just straight tobacco focused, but then of course when the height of the vaping pandemic came through, we had to be more inclusive and include the nicotine.
Yeah, and I had heard that in Jefferson that is very, very high in the school system.
Yes, so unfortunately we've had a few of our school districts report that vaping is really one of the big key indicators of substance use. They do have different variants of like kiddos that are vaping THC, and then ones, of course, that are just, you know, getting the regular the regular vape cartridges off. Whether you go on Amazon, you can walk into some convenience stores, of course, and purchase those if retailers aren't carting, so on and so forth. But yeah, unfortunately, it's been kind of a big issue that we're trying to work and partner with the schools on and trying to combat that.
With all you've been doing, have you seen a big change from alcohol, which used to be the big thing in school, to drugs? Is it about the same, or have the drugs more taken over where the alcohol?
Yeah, so we typically refer to that as like alcohol being the gateway drug into experimenting further into harder substances. I would say realistically, alcohol still presumes to be the gateway. However, marijuana actually is really kind of foreplaying into that as well. So more often than not, like a lot of people will say that they'll start with alcohol, but realistically now we're seeing where a lot more youth are saying they're starting with marijuana just because it's becoming a lot more accessible, given that we, of course, border Illinois and Minnesota where it's legal for recreational use. So although that's not a priority substance of ours, it's definitely something we still keep our eye on with. We work with, obviously, our different districts' police departments as well as our drug task force and try to at least provide whatever training we can to them so that they can combat it when they encounter it.
How much of an issue is the CBDs and the Delta 8s and 9s in our area?
They're unfortunately very prevalent. So we are seeing, and we've even actually had schools report where kids are, usually the upperclassmen are the ones that are going down to, there's a dispensary down in Beloit, you know, right on that Illinois-Wisconsin border. And they're picking whatever supply is up and then they're bringing it back and selling it to kids, or they're getting requests even then they take the trip down there to purchase whatever products that the other students need.
And have you seen an increase of overdosing on the THC and the Delta 8 and 9, or just...
We haven't seen so much, I would say, the overdosing, which there's a lot of controversy with that too. A lot of people think you can't overdose on marijuana, which isn't necessarily true. Predominantly saying that because if it's laced with anything, like say you're just getting it off the street or from the dealer, whatever, odds are it's probably going to be laced with fentanyl or xylazine or what other type of derivative. Now, if you're getting it from a dispensary, it's probably a little bit more trustworthy, just because there is some more regulation around that. However, if you're using too much, you're probably going to go in more of a psychosis state to where you're going to need to go into like a hospital and pretty much detox that out of your system. So,
And then I've also heard that a lot of problems is they're using both the marijuana and the CBDs, and that's increasing their addiction and their problems. Is that true?
yeah, so, and I mean, I'm no marijuana expert by any means.
Right.
I will definitely say one of our drug task force detectives that we work closely with,
Ben, yeah.
he would be wonderful to talk more about that. But I will say, yeah, if you're using it in conjunction, it can, again, a lot of people, it really amounts to the dosaging, I think, a lot more than anything, as well as like the THC. THC, depending on how it's like manufactured, so say you're getting it illicitly off the streets, it's going to be more potent because of how they cook it and package it and so on. Whereas obviously with the dispensaries, they're supposed to have the regulation of how many milligrams can be in it. However, I mean, the packaging, where it becomes controversial and where it becomes inherited for our youth is that it's packaged to look exactly like Oreos, Smarties, Skittles, whatever the case is. So, I mean, like if a parent's not paying attention, I always give the example when I talk about this. Like when I was young and we'd stop at the gas station, my parents like go pick out a snack, whatever, and throw it up on the counter, they pay for it, you go in the back seat and you just eat it, right? So I mean, if a parent isn't being like observant about that, there could be the potential that you have a child that could like overdose because they're obviously ingesting more than what the recommended amount is on the packaging.
Right.
So therefore, you know, that's, I guess, in the essence where we'd say it'd be like overdose as far as they'd probably become lethargic and everything else. So you'd have to take them to the emergency room or the hospital.
What can we do as a community to target the companies that are targeting our children?
It's a good question. So I would say a lot of it is the advocacy and policy change, which I know isn't always easy to do. Obviously, with me being in the public health lens and role within Jefferson County, that's a lot of kind of the work that we're trying to justify. So we do, like with our alcohol compliance checks and tobacco compliance checks, it's working with our retailers to like really provide that education and training to them and updating their policies even of what tools can we provide you to best serve so that you're not serving our youth, whether that's alcohol or tobacco. So really a lot of it's just the advocacy, getting educated on it. Unfortunately, more often than not, people just use social media as their educator when unfortunately it's not always the real information and correct information. So I always recommend going to the Wisconsin DHS websites. They've got different ones. The Real Talks campaign really does a good job as far as like promoting for how parents can talk to their youth about substance misuse, because more often than not, people just don't want to talk about it. So I think really where we go as far as policy and advocacy is not only educating ourselves, but like being open-minded and even just having the conversation to destigmatize what revolves around substance misuse. And of course, like mental health kind of goes hand in hand with that.
Yep. The Elks has another program too called Awkward Conversations.
Okay.
And it's a really good video on different areas of drug addiction and stuff. And do you remember the show? Can't think of the name of it now. But anyways, a famous star is the narrator of that, and it's a really interesting program. So
yeah.
Now you say you do stuff with alcohol. What kinds of things do you do to get out into the community and get the information about the alcohol abuse?
So we typically attend community-wide events, whether that's national night out events where you're partnering with law enforcement, the Jefferson County Fair, any school activities, whatever the case is, wherever we can kind of get our foot into the door, we would like to be there to provide that information. So I know right now with COVID, it really threw a wrench in, especially with alcohol compliance checks. Unfortunately, law enforcement are just like with everyone else, they're dealing with very short staff.
Yep.
So therefore, we're trying to work with them to get those back up and running in our county. And some of them may be, that's actually an initiative that we're trying to figure out from the coalition side, is working with our law enforcement to determine, okay, who's completing alcohol compliance checks? Are they on a regular basis? So on and so forth. Ironically enough, I'm actually going with Watertown PD this Friday to do alcohol compliance checks.
You'll have to let me know how that goes.
To ride along. So I'll get the data and everything from that. But we are trying to work with them as much as possible as far as, because it's just one step in the right direction that we can hold retailers accountable to ensuring. But of course, as we know though too, like if parents in Wisconsin, the drinking culture is a big issue, of course. But I mean, if a parent is with their youth in a bar or restaurant and they say it's okay for them to consume alcohol, like there's really nothing we can do about it. Obviously,
their parent is there.
Yeah,
that law has not changed.
No, unfortunately. So I mean, obviously, it's really kind of looking at probably restructuring how a lot of the alcohol compliance checks for the retailers look. So I know in Watertown, Ben, one of the officers, was telling me that they've got a point system in place. Not 100% sure of how it all functions, but it sounded more enticing to where retailers are more apt to follow and check IDs and so on and so forth. Whereas like in maybe different municipalities, they're not as likely to, because there really is no harm, no foul.
Yeah.
So hopefully, knock on wood, but we do just, again, try to bring as much education, whether it's like with teens and going through like their driver's license courses and, operating in a vehicle under the influence, or, just anywhere we can really have those conversations. We're pretty much trying to be out in the face forward into like the community. So
well, that's why at the Lights and Sirens, when we were together, the drunk glasses,
Yep.
that was so hilarious, watching these kids and then getting them to realize that that's how you feel when they're drunk.
Yeah, we would hear a lot of kiddos say like how dizzy it would make them, or they'd get a headache, or just them trying to like walk on the crack of the sidewalk and kind of seeing them stumble around. So obviously, for those to be effective, it's really to have those conversations then with them of like, okay, like this is what it would be like if you were impaired, and now imagine being behind the wheel and operating a vehicle, and so it definitely opens that door to have further conversation with both the youth and their parents.
Now, on a more personal level, can you tell me why you do what you do?
Because I love my job.
No, I mean, is there something in your life that brought you to this? Is there something in your family that you thought you needed to learn all this?
Honestly, it kind of was happenstance initially that I landed within like substance misuse, mental health, the realm of everything. When I was going through college, I wanted to do dietetics, like I wanted to do nutrition. And then thinking that I could go the public health route, because I have a degree in public health and psychology, that I could get to the dietetic, go and get my license for that. And then honestly, after college, did what any other college kid did, applied to anywhere and everywhere. And I ended up actually getting hired on at a nonprofit down in Iowa, where we focused on problem gambling, tobacco cessation, alcohol, like so on and so forth. So, and it just kind of kept spanning from there. Obviously, yes, I mean, definitely have family, of course, that suffers from mental health and substance misuse. Honestly, I think it's more prevalent than a lot of people think. Which is, again, a big reason why we need to diminish the stigma and have these conversations. But I feel like more often than not, a lot of the people I talk to that are in similar positions as me, you typically probably have some form of emotional connection to it, as far as whether, you lost a loved one or someone that's suffering from it, whatever the case may be. So, and I mean, honestly, the community partners, the relationships I've made in this field are, you can't beat it. I mean, unfortunately, substance misuse, especially looking at the opioid epidemic, how many lives were lost, and a lot of that could have been preventable, as far as like us speaking up and raising awareness and, providing resources and everything. So Just kind of my mission of, obviously I want to help out, definitely natural caregiver. So any way I can help individuals out, this is just the field to do that.
Well, you're doing a great job, and I've enjoyed
Thank you.
working with you on all the different things.
Thank you.
As I said, I've worked alongside with the coalition in a few events, and I find that your organization is very insightful and goes out of its way to share drug and alcohol misuse in our communities. With all you do within the community, do you think we're getting the message out enough?
I do feel we are getting it out. It's just whether people are receiving it or are receptive to listening. And I say that because looking at the YRBS, or the Youth Risk Behavioral Survey that students take every 2 years, we actually are seeing a decrease in substance misuse amongst our youth, which is great.
Yeah.
Not big, like not
Hey.
5%, but I mean, you
Yeah.
know, something's better than nothing. I'll
Yeah.
take it as a win. So I mean, I do feel that there's some data that does show whether people are getting connected to the resources that they need to be, or we're preventing it altogether. We are kind of seeing different trends with that. So fingers crossed that it continues that way. But again, it's beyond even our coalition. I mean, of course, we're there to be that support factor and provide resources and whatever we can. However, you know, it takes the community to kind of put their leg up and help us to continue to spread that word and to provide education and like be open-minded and be involved with what we can do. So,
And working with you on the Knowledge of Power events, I found that the hardest thing to get is get the parents to be involved.
yeah,
So-
getting community engagement is very difficult, and I wish I had the answer as to
I
like
know.
what that barrier is. Really, I do feel a lot of it is the stigma with it. I think a lot of people are just afraid that if they attend these types of events that, such as the Knowledge is Power, that it's going to label them right away. And it's like, we're just trying to educate and provide whatever resources we can, because again, more and more people, it's more common that people are suffering with it, whether they want to admit it or not. We just want to be able to provide that helping hand that folks might
Right.
need.
Right, yeah. Let's go on to a different subject right now, Narcan. Let's talk a little bit about that, how you as a coalition work with Narcan and the, I can never say that word,
Naloxone.
naloxone.
Yeah, so the Jefferson County Health Department, which again is where I'm employed through, but work for our Jefferson County Drug Free Coalition, we are actually a Narcan Direct program, which is funded through by Wisconsin DHS, Department of Health and Human Services. So it's a free program to us. They pretty much, with the opioid settlement dollars, have used to purchase or disperse certain allotments of how many cases of Narcan each county, nonprofit, I mean, anyone can get it. Police departments, they've expanded with fire and EMS. So that Narcan's completely free to us, which is amazing, because then we get to give it free out to the community. Because obviously some people may be aware that you can get a prescription for Narcan, but it doesn't necessarily mean your insurance is going to cover it, or it's not going to cover it all the way. It's available over the counter now that anyone can purchase it, but like, why spend $50 to $75 that someone probably doesn't even have to begin with? Why do that when we can do it for free? With handing out our Narcan, I am the main one, but we do have a few community partners that also offer Narcan trainings. So I know we did a lot last year as far as offering them to the community at the libraries, whether it was businesses reaching out, asking if we could provide their staff with Narcan training. And it's just a good way to have that additional conversation with them. So
we had it at the Watertown Elks, and we're working on having more.
Absolutely.
Let's see, with the Narcan, do you think that's, I mean, I know the hardest part about Narcan is the stigma. And it's hard to get past that. Well, why give it to somebody who's just going to overdose again?
Absolutely.
How do we get past that?
I know, it's definitely a mind shift that individuals have to be open to. So realistically, no one intentionally overdoses or intentionally wants to end their life. I mean, same with suicide as far as that goes. Unfortunately, Jefferson County, we don't have a lot of resources. We don't have a detox center. We don't have residential. Thankfully, yes, we border both Waukesha. I mean, we do border as far as like Rock and Walworth County, but they as well don't really have a lot. But even Madison, it's just there's not enough resources available. I mean, if it was as easy as being like, okay, I can call the inpatient, hospital and have a bed ready for that individual to get there, to get them into treatment and, start their recovery journey, like we would not have jobs. Like it would just be that easy, unfortunately, because they're understaffed. There's not enough beds. There's not enough resources and services, unfortunately, for those individuals. Like, what else are they gonna do? And it's also the factor too, like, they have to be maybe on a wait list. So depending on how long that could take. But then in the meantime, what are they doing? They're maybe homeless on the street. So then they obviously are using substances to numb the pain, to keep themselves awake all night, just so that they don't risk the chance of being mugged or jumped or, beat up like that. And then it's, maybe they can't get out of the situation, the housing situation that they're in or community that they're in around the people that also use substances. So I think when people think about the fact that Narcan's just feeding into that substance use, they're thinking very, very narrow-minded. Like, we got to think more broad as far as the trauma that relates to it. And again, people are using to potentially self-medicate, or depending on what their home life situation is like, maybe they've got mental health issues that, that's how they silence the noises, or whatever the case is. So I think people just need to be more conscious and mindful of when we're thinking about this, think of it from a broader spectrum than just, obviously why keep saving them or why keep providing resources that if they're just going to continue the behavior. It's not that they want to, they just realistically don't have a choice until they get that opportunity, which may be months down the road, if we're lucky that they are hopefully still alive long enough.
Now, I know we discussed a while back about getting Narcan in the local bars. I have found that it's very hard to do that.
Yeah.
Do you know why?
I think in some regard, and I mean, obviously this is just my own personal take on it, is I think a lot of people are afraid that it's gonna attract those type of people to be coming in and using like their bathrooms for but
like unfortunately injecting. They already are.
In hindsight, so I mean, I don't know. I don't know if it's like it's another thing, they don't want to defer people from coming in because they have Narcan or what. I mean, obviously there's definitely different communities, whether they're surrounding us or even throughout Wisconsin as a whole, that they've been able to implement it within their bars and putting it like in their restrooms, or even just having their staff trained just in the off chance that it needs to be administered. So I think a lot of it is just having additional conversation with whether it's even just the Tavern League as a whole, and see like if we can work with them to get it in. But it is hard to say, because I mean, I wish there was one reasoning that hits all, but I know you kind of hear everything from the different ends of the spectrum. So hopeful, I mean, still hopeful. It's definitely something we want to work on, obviously, within like now this next year. So
what else would you like to bring up that you do at the Jefferson County Drug-Free Coalition?
What don't I do is probably the better question. I mean, obviously my position, I am the Drug-Free Communities Grant Project Director, is like my official title with the coalition. With the health department, I'm the Community Health Development Worker. Hand in hand, basically, I just go out into the community, develop relationships, and obviously provide education and resources. But obviously a lot of my role involves working hand in hand with our coalition members, specifically with our leadership board, but then of course all of the coalition to partner with our schools as far as getting education into them or getting staff trained on diversion programs. Obviously planning community events like we did with the Knowledge is Power. Realistically, we really want to be with our schools more than anything. But beyond, I guess, the coordination of that, like I do a lot of the data collection based off of how many people we serve at community events that I enter into a different database. And obviously for the Drug-Free Communities Grant, there's a lot of grant reporting that goes into it because of the amount of funding that we receive from them. So it's trying to kind of do a balancing act of a lot of admin work on the back end, but then also being very community facing as well, because I don't like to just be the one sitting behind the desk. I would rather be the one kind of like out in the community making those connections. So,
well, it's good to hear that there is a end to the story eventually, because it is, like you said, it is increasing where the knowledge is getting out there, and the drug addiction is getting lower for the children. What, as a community, can we do to go further?
I would say, if any, obviously our coalition is open to anyone and everyone in the community. They can email me, or like the coalition email, which is jeffcodfc@jeffersoncountywi.gov, which is really long. We'll probably paste it on the slide just so people can actually see it. But anyone's welcome to be involved, and I do highly encourage it, because right now we have a lot of professionals, which is great. Of course, we have everyone from, again, law enforcement to healthcare to human services to schools, and it's great. Like, we have all of the sectors, but like we don't really have the voices of our general community.
Right.
So we definitely would love to hear more from them, as well as like for them to understand what it is we do on our end. So I say try and get involved as much as possible. Definitely continue to keep an open mind. I know it can't always be easy, but if you've got questions, ask. And definitely don't believe everything you hear on social media is really the thing. So I always say, if people are like curious, you know, they can always reach out to me. We've got our coalition website people can go on. We're constantly trying to update that with information. So
And
I would say those are
all
the big
this
things.
stuff will be included at the end of the program. What can we do to get more facilities to help people with these problems? What can we do as a community? Can we reach out to our senators, our mayor? What can we do?
Yeah, I definitely think that almost falls especially back to the question that you asked with advocacy, or like I mentioned advocacy and policy. I definitely think trying to work, of course, with our senators and mayors and governor, that district attorney's office even, because they're going to know the law and more so how to navigate that better than what I can. I mean, I can read about it till I'm blue, but it doesn't mean I fully understand it. So having someone like that in your corner is ideal, especially if you're trying to do policy change in your communities. So I would be hopeful. I know when we were at the Watertown National Night Out event, someone, and I'm not going to remember who it was, but they were from one of the senator's office in Milwaukee. So he had given me his card. So it's like, you know, you make those connections. You don't see them too frequently, but you know, obviously if they're willing to be involved and provide that voice, they're the ones that can take it that step further to help us actually achieve policy change.
Okay, so it takes actually our community getting their voice out to them, so they know their constituents want something like this.
Absolutely, and I know there's different, like if something's going to the House to be voted on, they'll accept public comment. So whether that's like, you know, you're writing something in or you send a letter or whatever the case is, I would highly encourage like people to kind of pay attention to that. And that would definitely be something to consider if you feel strongly about, you know, what the topic matter is at hand.
What has the Jefferson County Drug-Free Coalition got in the future that they want to get going?
Yeah, so thankfully we've been awarded for the next 5 years, which is great. Recently received our notice of award. So what we're planning on is contracting with Vive 18. They're a nonprofit, and they focus in regards to specifically working with schools and developing youth like peer-led groups for which they can be the ones to like create basically change amongst their peers. So we're actually meeting with them next week in hopes that we can get the contract in placement. They'll stay with us throughout this school year, and then they'll help us kind of action plan and set us up for like the next year to just continue to carry through that work. But we do really need that, because the youth's voice, as far as like from the drug-free community's requirements, it's supposed to be from them, as it should be, because someone of like our ages, and youth don't want to listen to us,
No.
let's be honest. So
Yep.
if we can get them to do like more peer-to-peer
Yes,
activity,
yes.
plus it's also a chance to like get their skills sharpened, especially before even going to college. Like it's good experience of like if they want to create some type of community-wide event, you know, working with the youth to go and ask for donations or, you know, ask for petition or whatever the case is. So it's not only just like the substance misuse aspect, but it's also trying to provide them those resources or skill set more or less to, you know, advance on into if they go off to college or, you know, just adult life.
Do you have any peer groups that you're working with now?
Not like very closely, but I know Jefferson School District has been absolutely wonderful to work with. Obviously, you know, we did our first Knowledge is Power there. And I know they have a new, I think it's called like Pupil Services, their director. Her name is Jennifer, and I just met with her, I think earlier this week, and she's absolutely wonderful. I already kind of gave the pitch in regards to having Vive 18 come in. And they're very much on board with it. They do have, it's called a Hope Squad, which is already kind of a set group of youth that participate in it. And it focuses more on the mental health, but we're obviously going to combine because, again, mental health with substance misuse, it's kind of
go hand in hand.
Exactly. So we're hoping to work with them. October 30th, we're planning a suicide kind of prevention screening. It'll be a documentary that's going to be available.
Nice.
So, and then we'll have a bunch of different just resources. And then technically this is something that the youth came up with. So I'm very
that's
hopeful
awesome.
that like we'll have a little bit better attendance and output with that. So very much looking forward to partnering with them on that.
Oh, I can't wait to hear that. And please send me that documentary.
Absolutely.
Because I'll get it on here.
I can do the trailer for it. I don't have the actual like DVD. So,
Okay.
but yeah, absolutely. I'd be happy to.
Okay, that'd be great. Anything else you'd like to say before we go on our way?
I don't think so, no. I mean, obviously, again, if anyone's interested in participating in the coalition, they can reach out to myself. They can visit our website. And obviously, we're here for anyone that needs help. I mean, even if it's just calling the health department and asking the question, they'll get you connected to who you need to, which more often than not is me, so.
Well, the Watertown Elks Drug Awareness Program thanks you for working with us one-on-one. It's been, this last year has been amazing for me. I mean, we had the Knowledge of Power. Granted, we didn't have much attendance, but it was something that was on my plate that I wanted to get going. And hopefully next year we can bring it back again and be stronger and get into the school and actually do it. That's the way we need to do it.
Absolutely.
So thanks for being here today, and we will have you again soon, I'm sure.
Sounds great. Thank you.
Thank you.